Bill Gates and the WHO are implementing a global vaccine compliance network called Immunization Agenda 2030. And yes, it has direct connection with UN Agenda 2030 and digital ID. Let me take you through it. The WHO and the Gates Foundation, which is involved in a lot of this stuff, has created a globally interoperable digital ID infrastructure. Now, this is meant to permanently track every individual vaccination status from birth. This integrates personally identifiable information with socioeconomic data, including your household income, your ethnicity, and your religion. Like, what do they need to know your religion for regarding your vaccination status? Hopefully, you can still use religion to opt out of vaccines. It utilizes artificial intelligence to identify and target the unreached and to combat misinformation. Of course, that's the misinformation that they particularly deem misinformation, not necessarily what is actually not true or true. It enables governments to weaponize vaccination records as conditional to access services such as education, travel, healthcare, etc. We've talked about this with digital ID. Its point is to condition you to have certain compliance measures in order to access services in the public sphere. This is the vaccination or immunization part of it. So from the WHO and Gates Foundation, this is all called Immunization Agenda 2030. It is linked directly with the UN's Agenda 2030. The strategic development goal number 3 has a couple points in there regarding healthcare and vaccination status. This aims to ensure that everyone, everywhere, at any age, fully benefits from vaccines. Now notice, it says fully benefits from vaccines, not that it has access to, has the choice of, has the option, or has availability to choose vaccines, but no, it's for the full benefits from vaccines, which to me means you comply or you get kicked out of the system. So you must be fully vaccinated and comply. There is no choice or access or availability. That's not what they're talking about. There's no choice there. That's not the core issue. So this means basically a global vaccination compliance system that's digitally tracked, monitored, and enforced. It is a cradle-to-grave system of tracking you. You are registered at birth with a digital ID, so lifelong tracking. It generates lists of the unvaccinated as well. This will put you on a list if you're unvaccinated or you didn't fully comply with the full vaccination schedule that they recommend. For everyone's vaccine status, it must be globally shareable. Okay, this is a global program. This isn't just local, county, state, country. No, this is global. And of course, it includes the model of surveillance. So your community health worker, these are non-clinical workers, by the way, can identify and refer children for vaccination through electronic immunization registry. So we're talking about non-clinical people who can come into your house and say, oh, your child's not fully vaccinated. And so they then refer it to the authorities that you're not fully vaccinated. So all of this points to an infrastructure for global vaccine compliance. A network is all connected to digital ID. Every point of contact in the system becomes a checkpoint. Did you do this? If not, you can't move forward. Are you fully vaccinated? If not, you can't have access to this or that. This will also shape behavior through alerts, reminders, and social monitoring. This has Bill Gates, the Gavi Vaccine Institute, with the World Bank, UNICEF, and the WHO written all over it. It is a global digital ID system permanently linked to vaccination status, your socioeconomic and demographic data, driven by AI surveillance, designed for international interoperability and forced compliance. This is the vaccination part of the digital ID. I originally did not know that there was an Immunization Agenda 2030, but yes, there actually is. You can go to the website and check it out. They have all beautiful language to say that it's all for benevolent, trying to help people out. But as we saw in 2020 and beyond with the whole COVID scam, it will be forced compliance. You will be forced into getting things you don't want to get. So as much as you can, I'd advise pulling yourself out of the medical industrial complex as much as possible. Make healthy, truly healthy life choices for yourself and your family. I think the only thing that the healthcare system now is good for is emergent care. But the healthcare system to keep you healthy is not what it is. They don't have healthcare to keep you healthy at all, because the stuff that they recommend, the stuff that they inject, it's shown over and over, it increases your chance for chronic illness, neurological disorders, and more. So beware, know what's coming down the pike, know what's coming out. The more you are aware, the more you can make informed choices for yourself.